My name is Ayesha Akinkugbe. I'm a consultant dermatologist at the Lagos University Teaching Hospital and an associate professor with the College of Medicine, University of Lagos. My project is titled MASHAPA, Making Skin Health a Priority for All and More, MASHAPA Plus. It's an initiative that's aimed at improving the skin health indices amongst the inhabitants of Makoko, a vulnerable riverine community in Lagos, Nigeria. This project came about because I had gone into the community having a product with the Vaseline Healing Project, where we offered skincare services and dermatological services to the mothers and the entire community, and I recognized the need. So it addresses the high prevalence of skin disorders of public health importance in the community, which disproportionately affect women and mothers. These conditions not only affect their physical health, but it contributes to social stigma, reduced self-esteem, and poor quality. So the whole idea is to promote proper skincare routines, integrating education with mentorship, empowering mothers with knowledge to care for their families. So it will not only enhance public health outcomes, but also foster long-term community well-being and good health. So the problem, there's a high burden of untreated skin diseases. There's harmful skincare practices and low awareness. We all know that apart from the overcrowding and the fungal infections that they're prone to, we also have a background of the use of skin bleaching, skin lightening products, which do not help matters and worsen the skin health and long-term outcomes. We also have the social and psychological impact of skin disorders. So it contributes to their stigma, reduced self-esteem, poorer quality of life, and there's overcrowding and living conditions. So the project itself is aimed at addressing these concerns, particularly among nursing mothers and young girls via workshops and community health centers. Early intervention workshops will help the young girls on fundamental skin health problems, while also fostering a mentorship program, which we have commenced. So it fosters a supportive environment where participants are empowered with knowledge and access to affordable solutions. So what has been done? We've had our stakeholders engagements with local government and the primary health care. We've had focus group discussions with cohort of female doctors and medical doctors, and this has been very instrumental. It has also been part of what has given me the opportunity to mentor them and for them to look at things in a broader perspective as young and upcoming doctors, what impact they can make in the community while they are studying to become doctors. We've had advocacy meetings and implementation of the project where we sat down with the mothers for the first time, and we're planning other programs to go on because the Makoko, we did have some little problems because of the demolition activities that went on, but that's been taken care of. And so what did we find? We found that the key thing was education, finance. That was the main problem that we identified. So we also need to look at the end of the program, at the end of the study, what we will do is enlist key things that we can hand over to the local government chairman so that they can try and find funders, because they do have a lot of people wanting to fund this area. So the needs would also determine what funds they could look for. Workshops for the students are being planned. The post-project focus group discussions with the team to review what the intervention is and how to formulate a plan to address the findings, and then review our feedback from the primary healthcare staff as well. Advocacy meetings to implement the phase of the project. So in conclusion, this project so far has seen me utilize skills and tools from my leadership journey. I've had to meet with stakeholders, we've had to try and negotiate, we've had to think out of the box as to how we could adjust things, particularly with the problem that we faced earlier this year, to make decisions and to alter these to suit each situation. I've had to be patient and overcome all of these stumbling blocks. But I am applying my expertise to develop others through structured advocacy, technical input, and evidence-based programming. At the end of this project, I think I will have made a contribution towards education and prevention of common skin disorders in the community. And I look forward to the rest of the year and coming up with the final plan. Thank you very much.